Hi, welcome to Medicare Made Easy. My name is Hope Falgoust, and welcome to the beautiful Blue Cross Blue Shield building. You can see our beautiful view today. Today we are going to be talking about hurricane preparedness. I wish I could give y'all a better subject like crawfish preparedness or how to make a roux, but today we're talking about hurricane, and we hope this is helpful to our viewers. Now, each month we do have special topics. And if, as a viewer, if you would like to see a certain topic, please put it in the chat and we'll see if we can take care of that for y'all. But today we're going to be talking about hurricane, and we're going to give y'all some prep tips. Again, my name is Hope Falgoust. I am a licensed agent for Blue Cross and Blue Shield. So some of you may have even talked to me on the phone when you're calling into the 1-800 number. You may get me once they transfer the call. So now you have a face and a voice together. So welcome again. I have been with Blue Cross and Blue Shield for 5 years, and I am one of their Medicare specialists. And today we are going to just give y'all a few tips about what to do during the hurricane season. So the first tip is you want to be prepared. You want to make a list. So I would start with all your medications, okay? And do those medications need to be refrigerated? And what happens in the event that my power goes out? So talk to your family, talk to your friends, talk to your healthcare providers. You need to talk to your insurance company. What happens if I'm out of town and I'm on oxygen? So obviously that's something that needs to get charged, or your powered wheelchair. So those are all things you have to think about. And you need to ask your insurance company, ask your loved ones, make a plan. If I'm out of town, what do I need to do? How can I be prepared for this? So it's very helpful to, start thinking about this. Hurricane season is unfortunately just starting, and we have several months that we have to go through. So hopefully, everything is calm in Louisiana this year, but always be prepared. You can also go to getagameplan.org, and you can look at their website and see some of the suggestions that they have. So I also would like to say, if your loved one, or if you're in some type of nursing home facility, those facilities normally do have a plan for you guys. But the retirement home, if something happens to the home and you're not able to go back there, you may want to give them, your contact information. You need to give them your loved one's contact information if you're evacuating with your family. Now, also, always make sure you have your ID with you. So you need to have either your driver's license, your Louisiana ID, and also a copy of your card, your insurance card, okay? So that way, if you're at the pharmacy out of state and you need a prescription filled, that will help you as well as the pharmacy get the correct information to process your prescription, okay? So I am going to introduce, I am with my coworker, Miss Cathy Klinger, and we did not plan this twin outfit. It kind of just happened, but Miss Cathy's gonna take over.
Hi, my name is Cathy Klinger, and I'm a licensed agent with Blue Cross Blue Shield. I've been in the business for 11 years and 5 years with Blue Cross, and I'm really happy to be here. We're in the business of helping people with their Medicare benefits, and I'm glad that we're able to talk to you about these things. Hurricane season, again, it's already here. And like Hope said, she already gave us some tips on how to prepare yourself for in the event that you need to evacuate or away from home. Here at Blue Cross, our Blue Advantage members have virtual options for their health care. They can actually see a doctor from the comfort of their phone, computer, or tablet. If you had to evacuate, like Hope said, and you are away from our state or any other parish, you need to find out, how can I get in touch with my doctors, my prescriptions, and all that. telehealth is a great way to stay on top of your health care. Now, telehealth is with Blue Cross, it's called a Blue Care. It's serviced by Blue Care. So if you need to talk to a doctor, make sure you have this Blue Care app at your fingertips so that you have signed up and put your password in the event that you need it. Our Blue Care app is excellent for non-emergency conditions such as colds, viruses, or even bladder infection. So it's a great way to see a provider there. Our Blue Care app has a network of providers that are board certified and trained in the United States. So you'll be able to talk to an expert in that. We also have a network of providers you can see through our Blue Care, including behavioral health. You can schedule an appointment with this app. I'm going to tell you how to get there. If you need to see a psychiatry or psychology provider, they're trained through our telehealth service. And some of these providers can even prescribe medication through telehealth, which is a great way for you if you happen to not have enough medicine. We also how to get your Blue Care app. So you can go on your website at our website, bluecare.com, or you can download the Blue Care app on your smartphone so that you'll have it ready so when you need it. You can talk to your providers to see if they participate in the telehealth service, and you can talk to them as well. Again, this Blue Care app, it's available in 50 states, 24 hours a day, 7 days a week. So that's a good thing. Now, if you're not a Blue Cross member and you happen to be away from home and you need to find out how to get in touch with a provider, contact your medical insurance, your Medicare insurance, to see who they have as a telehealth service so you're prepared. That way you get to find out, if you can see your doctors or see any other doctor provider through that, through that line. It's very important that we keep on top of our health care, especially if we have any chronic conditions where we need medicine and stuff like that. So I like to say that if you're a Blue Cross member, please download your Blue Care app. If you're not, just contact your regular insurance to find out what their services are. All right.
Okay, so we also have a special guest today, Blue Cross Blue Shield's pharmacist, Miss Candice Allen, and she is going to give us some tips on how to be prepared during this hurricane season.
Hello, thanks for having me. So
Hi,
I'm Candice
Candace.
Allen. Hi, how y'all doing? I'm a pharmacist here with Blue Cross, and in my role, I develop, I maintain, I implement population-based clinical strategies, mainly pharmacy interventions, and I also have a big focus on medication adherence. So as you all mentioned, taking into account our health is so important while we're making our plans for hurricane season. And I like to think of the 3 Ps in hurricane preparedness, as well as planning for making sure you have your medication on hand. So we're going to prepare, plan, and protect. The first thing we're going to do is prepare a medication list. Write down every medication that you take, the strength, how you take it, the provider that prescribed that medication, and that provider's contact information. You want to have all that all that information organized, up to date, and readily available in case you have to leave home and you're not scrambling trying to figure out all the things that you need and how to take them last minute. The next thing you want to do is plan for having enough medication on hand. Those long-term disease states, diabetes, high blood pressure, high cholesterol, maybe you've been taking these medications for years. Many times you can get a 90-day supply. So to make sure that you are taking those medications the same time, the same way every single day, and to make sure that even in the event of a storm, you have enough medication on hand and you're not scrambling trying to get to the pharmacy when the line is wrapped around the corner with the storm in the Gulf, get a 90-day supply. It's also good to note that now is the time to be proactive, because even if you've been on a medication for a decade, that script that the provider writes you is only good for 1 year. Usually it has an expiration date of 1 year. So even if you've been on it for years, it might be time to get a new prescription, and you don't want to be waiting for a new prescription when the storm's in the Gulf. So get a 90-day supply, act on that now. And the last thing that you want to do is we're going to protect our medication. You want to make sure that you're reviewing the storage requirements so that if you lose power, if you have to evacuate, your medication is still safe and ready to take. Do you need to protect it from light? Does it need to be refrigerated? If you lose power and that medication reaches room temperature, how long is it good for? Ask those questions now at your next doctor's appointment. Call your provider, go to the pharmacy. No question is dumb. Now is the time to make sure that you are crystal clear on not only how to take your medication, but how to store it properly in the event of a storm, and that you're all organized and ready to go. So ask lots of questions and get ready now.
Thank you so much. Thank you so much, Candace. That's so helpful, all that information, to know we have our own Blue Cross pharmacist right here to answer any questions. And y'all, if anybody has any questions they would like to ask Miss Candace or Blue Cross, the agent specific to Medicare, or about hurricane preparedness, anything, y'all go ahead and drop it in. We would be happy to help y'all. Blue Cross Blue Shield, we are here to help our members. I remember during this last hurricane, Cathy, I mean, we were working off of generators.
Yep, we sure were.
Yeah, so we're here for y'all. So you just give us a call. Oh, I do have a question that just came in from someone in Baton Rouge. Okay, her question is, I'm turning 65 later this year. When do I need to apply for Medicare? Okay. So this is a very common question that we get, okay? So if you are receiving Social Security benefits, you will automatically receive your Medicare card. If you are not receiving those Social Security benefits, we see people or talk to people all the time. They're working to their 70, they're 75 years old. They love to work. So they are on group insurance. So they do not need to apply for their Medicare. But if you are in the situation where you are, undecided on the date that you're going to retire, or that's in the near future, and you are not receiving those Social Security benefits, you're going to need to contact the office and get that Part A and that Part B. Yeah. But when you call in, if you need more explanation, we'll be more than happy to help you step by step.
Yep. I do have another question here, which leads a little bit to what she said. And I just wanted to mention that if you are turning 65 and you have group insurance, basically you have the option to postpone your Medicare for a later date, as long as you have what is called credible coverage, because there's penalties involved if you actually don't get your Medicare on time. So make sure that you're prepared. There's a window of 7 months that you have to follow if you are going to go on Medicare and are not on Social Security benefit check. You have 3 months prior to your birthday, the month of your birthday, and 3 months after your birthday. Now, if you're going to continue to work, you can go ahead and keep your work insurance until you're ready, and make sure that you have credible coverage after the age of 65. Those are crucial information that we get on a regular basis. Yes. Do I have to do that? I don't want to get a penalty. Know that as long as you have credible coverage, you are good to go. And you have a prescription drug plan as well with it, because those are key important things that you need to have. So basically, in other words, do I need to keep my health care if I'm still working, or do I need to apply for Medicare? If you want, you could, but if you want to stay with group insurance, again, just make sure that you have credible coverage.
Yep, you can call an agent here at Blue Cross, 1-800-568-1417, or you can visit us on our website, BCBSLA. I did say that kind of fast, so just know Blue Cross Blue Shield Louisiana plan.com/Medicare. And we would be happy to help anybody answer those questions. I know everyone has Medicare experts in the family, okay? But we are licensed, and this is what we do daily for 8 hours a day. And we are able to help people throughout the entire state of Louisiana. We are very blessed to have this capability. And Cathy is also bilingual. So if you need go ahead, Cathy, give us a little bit.
Yes, I like to reach out to the Spanish community out there. If this sounds like a puzzle to you, or you know anyone, a family member or a parent or anyone like that that needs information in Spanish, I'm here. I'm your expert when it comes to talking about Medicare. Here at Blue Cross Blue Shield, you'll be talking to me if you want to talk to me in Spanish. I speak both languages, and I'm here to help you to put your Medicare together. Medicare is like putting a little puzzle together. And sometimes it could be very overwhelming. You're like, how do I put the A, the B, the C, and the D?
Yes.
So we are here to help put that puzzle together so you understand it.
Yes.
We take our time with our members. This is what we do on a regular basis. We're in the business of helping people, right?
Yes.
So we're very proud to be part of this here at Blue Cross Blue Shield to help our Medicare members that are looking for information. I like to mention that we have our Facebook page where you can actually go in and share some of the tips that we offer about Medicare. We also offer Medicare 101 if you're interested in learning about that. And also our YouTube channel. It's amazing. You're going to find so many things there about how to get health care and how to get, things that happen like hurricane today. You can talk about prescription, you can talk about anything that has to do with, needs for your health care. Subscribe to your YouTube channel at bcbsla.com and make sure that you subscribe, get notifications whenever we have any events coming up. And you're going to be talking to us if you call that 800 number. We're the people that you get to talk about Medicare. There's no obligation to talk to us and learn about how to put your Medicare together. I also like to mention that if you need any of this information in Spanish, you'll be calling me. So make sure you get my number there. My name is Cathy Klinger y yo hablo español. You want to? She's been so great. Candace, that was great information too.
Yes. And look, sometimes when you get me on the phone, I may not let you off the phone because I need to know, dinner, what we're doing. But we're very personable, and I pride in all the agents here at Blue Cross. We do pride ourselves. We are not sales. We are going to inform you. And if it works, if Blue Cross is a good fit for you, that's great. And if not, then that's great too. You have to see what your needs are when you're trying to decide on any type of health insurance and what's going to help you sleep at night. And so that's what we do, and it doesn't always work for everyone. So
right.
Yeah.
When we do our job, we're so thorough about going over doctors, medicine, their needs. Hey, I need to see this doctor at this particular location, or I need to be able to go to my pharmacy. We try to, put everything together for you, and that's how we do such a good, step-by-step job to help Medicare members make the right decision, what fits them best. So
when people call in, they are very anxious. Okay. So we just try to ease that anxiety by explaining, and by the time we're done, people usually have a very good understanding.
Yeah, that's right.
All right, guys. Well, we had a lot of fun today. Thank you
Yes.
so much, Kathy and
Thank
Miss
you.
Candace, and we'll see you guys next month.
All
Bye.
right. You guys take care. Have a great
Bye.
day. Thank you for joining us.